Thank you so much for joining us today.
Hi, yeah, thank you for having me.
You are more than welcome. So, I think probably the best place to get started tonight, Tanya, is if you could just tell us a little bit about yourself and how the Mastectomy Tattoo Alliance came to be.
Yeah, so I am a tattoo artist. I started tattooing around about 2009, and I offer sort of a variety of different tattoo services really. So I do sort of decorative like body art tattoos. I offer cosmetic tattoos, which is more widely known as permanent makeup, so like your eyebrows, eyeliner, lips, things like that. And then I also specialise in medical tattooing. So it's most commonly known for creating like 3D realistic nipple tattoos after surgeries like mastectomy surgery and gender
Yeah,
affirming surgery, but can also be used for a number of things. I create 3D belly buttons after sort of
oh,
surgeries.
amazing.
I work with a lot of burns and scars. So it's just a really nice restorative form of tattooing.
That's amazing. And as you say, it's much more varied than I think people realise. And
Yeah,
I think the aim today is we're going to try and cover all grounds, so both decorative and nipple areola tattooing, and because there are obviously some differences between the two, and we will be trying to give some practical tips and advice and some signposting for people. So we'll see how much we can cover through the session. Maybe let's get started with nipple areola tattooing. If you could tell us a little about a little bit about what they are, and sort of how they're done, how they work, and we'll take it from there.
yeah, of course. So nipple tattooing is um, it can be used for a number of reasons. Obviously, it's there to help the breast cancer community after their mastectomy surgeries and breast reconstruction, and sort of risk reducing surgeries as well. It can also be used after gender affirming surgery and also any kind of like cosmetic surgery, sort of breasts, breast uplifts, reductions, enlargements, and things. But the 3D nipple tattooing in particular is sort of really well known for helping the breast cancer community, and it can be used to create a 3D realistic effect to recreate an areola nipple complex really. So you can use that type of tattooing to create the illusion of a 3D realistic nipple on sort of flat skin, flat reconstruction skin, and also alongside nipple reconstruction. And it just sort of helps give that final little bit to the journey kind of thing, and just give you a little piece of yourself back.
Yeah.
I think our nipples are part of our identity, and I think until they're gone, you don't realise that maybe as much, or we take them for granted a little bit. So these tattoos have a huge impact on people, not just sort of with their physical confidence, but also like their emotional well-being as well.
Absolutely. And I think a lot of people that we speak to through the helpline and sort of in the clinics, having that nipple tattoo is quite often the last stage of their reconstruction journey.
Yeah,
So it really does for a lot of people symbolise that kind of moving on from the breast cancer treatment. And as you say, it can also be used with nipple reconstruction. So would that
yeah.
be just having that areola tattooed in that situation around the reconstruction?
I create an entire 3D effect alongside nipple reconstruction, because you can sort of be clever where you put your sort of little lights and shadows, and you can create extra 3D effects and just kind of give a bit of texture and a realistic look to the entire area. So I tattoo the actual nipple area as well as like an areola sort of shape and colour as well, and you can put sort of little wrinkles and textures and bumps and stuff
Amazing.
in, and yeah, you can be sort of really clever about it. And I come from a very tattoo point of view. I'm a tattoo artist originally, so I use like sort of tattoo ink, tattoo equipment, tattoo needles, a very similar tattoo process. Um, Mainly because I believe that these tattoos should last as long as possible.
Yeah.
Um, our skin's a living, breathing organ. Things are going to fade, over time as our skin ages. But I think it's really important to try and make it as long term and as permanent as possible. Not just for that person, you want to move on, don't you? Like you say,
Absolutely.
it is that nice bit at the end, and it's a reclaiming stage, isn't it? But I think physically on the skin, you don't want to be tattooing that skin over and over again,
Yeah.
topping that colour back up, every 6 to 12 months. It's no good for the skin, especially if there's scar tissue. If you had sort of treatments like radiotherapy and chemotherapy, that affects the health of the skin. So for me, I think it's important for it to be as permanent and sort of last as long as it possibly can.
And so are there some options that aren't as permanent?
There's different kind of inks that can be
Okay.
used. So quite commonly within the NHS, they use what you call semi-permanent inks. And they're all sort of part of the same family, if you like, but the semi-permanent inks are a little less concentrated kind of thing, and are just designed to break down quicker in the skin. So those sorts of inks, they're great on the face for like your eyebrows and things like that, because trends come and go, our face ages and changes a lot, so it's nice to have that wiggle room where
Yeah.
it does fade and you can kind of change things over time. But for me, when it comes to like the nipple tattooing, you don't want to be having to revisit it all the
Yeah,
time like
absolutely.
that.
That makes
So
sense. And that's a
yeah.
really, really interesting for people watching who might be thinking about what they need to ask, what questions they need to ask if they're thinking about getting a nipple tattoo, is to ask, is this a semi-permanent or a permanent? Because that might help them with their decision making. And
Yeah, and
we,
it's a very complex subject, to be honest, and it can
yeah,
be spoke about it at length. But there's so many factors that would contribute to that tattoo, like sort of aging or fading prematurely. One of them is the ink that's being used, but also the processes and the techniques that are being used, which is another reason I think seeing like an experienced, qualified um, technician
absolutely.
that can put it in sort of safely and effectively, so your results last as long as possible.
Amazing. And we've had a question come in from Stephanie who's asking about how many sessions it takes to create a 3D nipple tattoo.
So
Great question.
it is a really good question. Everyone has their own little ways as well. For me, I like to do things over 2 sessions. Sometimes it might need more. Everyone's skin's different. Everyone's like mastectomy journey has been different. Everyone's treatment plan has been different. So, sometimes it can take a few more sessions to build that colour up to the level we want it, kind of thing, to make it look nice and natural. But for me, 2 is usually enough. And I do space those treatments about 8 weeks apart. The reason for that is to make sure that kind of delicate skin, it's been through a lot already, that
Yeah.
we just give it plenty of time to sort of recover and settle again before we tattoo it again, sort of thing. So
Yeah.
even though the tattoo itself does heal relatively quickly, like usually within sort of a week or 2 approximately, I like to leave it that little bit longer before we do the second treatment to respect the skin more than anything. And the reason I like to do it in 2 treatments is to build that colour up nice and naturally. So what we're not doing is trying to create a picture, which is
Yeah.
how I explain it to people. We're not trying to create a tattoo that looks like a picture. We're trying to create something realistic that
Yeah.
replicates a body part. And I think it's good to build that up in phases. So you do get a nice, natural, soft look. And also it allows you to kind of tweak things if you want to. A lot of people, they might be a bit more reserved on their first treatment, want to go a bit lighter, maybe go a bit smaller. And then, once they've adapted to seeing their new chest again, they might want the areola to be a bit bigger. They might want to go a bit darker in their colour, or, so it's nice to have that second session or sort of second treatment kind of thing
Yeah.
that lets you make those little adjustments for people as well.
That's amazing. And before we go on to talk about if there's any differences in when it comes to decorative tattoos, there's just a couple of questions that have come in around tattooing when somebody's had an implant reconstruction. So obviously
Yeah.
when somebody's had a mastectomy, it can be reconstructed in different ways. And one of those ways is to have an implant put in. So one of the questions was around if you have to be careful with your needle pressure with an implant in. And Sam has also asked if you can have a tattoo with an implant reconstruction.
These are really good questions, and I get asked this a lot with implants. I think people worry it might either pop the implant or disturb it in any kind of way. And to be honest, if you're seeing someone or you're going to an artist who is experienced in this and is properly trained, and is following everything kind of safely, it's perfectly safe to have a tattoo over your implant. Where a tattoo sits in the skin, there's several layers in our skin. So your tattoo's in these real top layers of your skin. And then obviously we have all these other layers and, our fat cells, our hair follicles, things like that. And your implant's all the way down here. Those skin layers can sometimes be thinner, especially, when our skin's stretched a little bit more over an implant, for example. But the layers themselves are still there. So when you're seeing an experienced artist, they can feel where that tattoo needs to go in those layers.
Yeah.
So there is no risk. And just to sort of reassure you even more, the needle isn't long enough. Tattoo needles are so teeny tiny. It's almost like a little biro. They just aren't long enough to be able to go in that deep to do anything kind of thing. But it is really important that you see someone that understands a mastectomy and implants and all those things around it.
And I think that's going to be a reoccurring theme tonight, isn't it? That it's just so important to make sure you're choosing somebody that has experience of working with people who've had a breast cancer diagnosis or have had breast surgery, just so that you've got that confidence that they are aware of how to tattoo in that situation.
Yeah, absolutely.
And I know we're going to come on to sort of that logistics side a little bit later. There's one more question around nipple tattooing that we'll address before moving on. And there's somebody called Challenge Accepted who has asked, she says she's got I'll just read this out in full. Can my slightly imbalanced nipple reconstruction scar make a nipple tattoo look off balance? So I guess that's possibly quite a common question about how the actual scars from having the surgery can impact how that nipple tattoo looks.
Yeah, and it can be a very case by case thing. In my experience, as long as everything's settled and it's really nice and well healed, I say a minimum of 12 months after any kind of surgery, just to really give those scars and that tissue around it just plenty of time to really settle, fully mature before you tattoo over it. And then in most cases, everything's kind of tattooable. And you can be really clever, like how you do things as well. So, sometimes I might even use the shape of a scar to create a little like wrinkle or bump, or, use a bit of a scar incision to enhance it and make it more of a nipple shape, or disguise it with a little bit of a shadow for my 3D effect. Like, there's all sorts of clever little tricks you can do
Things you can do to help.
Yeah, it just really helps disguise things and then create that nice, like, realistic look for you as well.
And I guess that's a really good question to take to the person that you're looking at doing the tattoo for. You say, this is my concern. How would you sort of address this problem? So I think there's no question that you can't ask. It's so important to ask the questions before you get started.
Definitely,
and as you say, the answers are probably going to be quite individual.
Yeah, like everyone's journey's so unique, isn't it, as well?
Yeah.
Everyone's surgeries are unique, their reconstructions, their treatments, like everyone's skin's different. So it is very, person by person. I definitely recommend always trying to have a consultation with your artist. You can't beat an in-person consultation, to be honest. Sometimes logistically it doesn't work. So, there's good old technology. But I think an in-person one's nice because you can see the space they're working in, and, you get a feel for the studio or the clinic. You get a feel for that person. You can ask all your questions, and, it's a real personal part of your journey. And it's the good bit, isn't it? It's the nice bit. It's the good bit at the end. So you want to make sure that experience is with someone that you feel comfortable with, that you feel confident with, and that they can answer all your questions as well.
Brilliant, that's amazing, Tanya. And just to move on to decorative tattoos, so some people either who have chosen not to have a reconstruction, so who have a flat mastectomy, or even after a lumpectomy surgery, may well consider a decorative tattoo on their breast or on their chest. And is there anything that's sort of different about that to having nipple areola tattooing done?
A lot of the technical principles are the same. So the tattoo still needs to sit in those same skin layers. For me, all the same equipment is being used. I do adjust my technique slightly because I'm creating different effects. So when I'm doing like a tattoo design, a decorative tattoo design, the look I'm trying to create is different to a soft looking natural 3D
Yeah.
nipple kind of thing. But, essentially it comes from the same family, if that makes sense. It's just, yeah, like the techniques and the approach are slightly different.
And I guess sort of all that we were just saying around, having a consultation and talking through what you want is incredibly important in that situation as well, because again, it can be quite an emotional, empowering thing for somebody to make that decision to have a decorative tattoo around their scars. So you want to have all those same reassurances as with an areola tattoo.
Yeah, definitely. And, obviously with a design, it's, a lot of people will draw things custom for you now.
Yeah.
So I draw designs for people like as a unique custom piece of artwork. So if I have a consultation for a decorative tattoo, again, I really like to see people in person. For me, I want to see like the skin and the scar tissue. I want to make sure everything's ready to be tattooed and stuff as well. So that side of things is important. But it's nice to chat about your design as well, so you can bounce ideas off each other. I'll sometimes sketch a little design straight on the skin, like at a consultation, so you can kind of see what I'm thinking, and you can just really bounce off each other.
Yeah.
Because like the possibilities are endless with tattooing now as well. Like it's so clever what can be done, and the artwork's insane. So it can also feel overwhelming because there is so much choice as well. So
And there's no rush, is there? If somebody's
absolutely
made that
not.
decision and gone to see an artist, there's absolutely no rush to go, oh, yes, yes, that's what I want. You take that time and, as you say, come to the right design together.
Yeah, definitely. I always I say it's like it's a collaboration between the
Yeah.
two. Like I'm going to share my expert opinion with you, and yes, I'm going to go off and do my creative thing, but I ultimately want you to be happy with your tattoo. So,
Yeah.
it's your personal choice as well. And I think finding the right artist is really important.
Yeah,
Um,
absolutely.
and the right artist, they will answer those questions for you. They will spend that time with you. They will make sure the design process is, that you're well looked after, kind of thing. So it's important to find someone that you feel comfortable with that's going to
Absolutely.
help you through it. Yeah.
And we always say to people, if we get phone calls around sort of, I'd like to have a tattoo, what's the time frame? We would always say, check with your clinical team, make sure they're happy, everything has healed. But in general terms, would you say the same for decorative tattoos? You'd recommend at least sort of 12 months?
Yeah. I mean, I always recommend speaking with your medical team as well. Like we're not medical professionals, we are artists. As much as we try and have all this knowledge to help us in this specialized area of tattooing, it's always best to double check things, definitely. For me, when it comes to any kind of surgery, 12 months is my minimum. You really just want to make sure that scar tissue's fully matured. And I think that, everyone, again, has their own answers. This is my personal preference. And it is in my experience that this is a good amount of time. Sometimes it can be longer for people as well.
Yeah.
And
Particularly if they've had complications, sort of with
exactly, yeah.
chemo, radiotherapy, different things can all impact.
Yeah, definitely. I do also recommend, chemo and radiotherapy a good 12 months
Yeah.
after that as well. Obviously, with chemotherapy, it eradicates the immune system.
Yeah.
And for me, it's important that you give like your body and yourself time to really recover. And, because you've still got to heal a wound, even though it's,
Absolutely.
a superficial wound, you're still asking your immune system of something. And I think it's important to let yourself have that time to heal before you sort of do something else. And with radiotherapy, it obviously does really affect the physical structure of the skin as well. So it's important that that really settles before you do anything.
Amazing.
But yeah, it's sometimes the scars can kind of look and feel like they're healed on the surface, but I sort of explain it. It's like a concrete floor. When you first sort of touch it, it might feel skimmed over and it's like set, but then you go and tread on it and you fall straight through it, kind of thing. And your scar tissue is similar. So there's still a lot of layers underneath that need that time to settle before you tattoo it again.
Absolutely. And we have had a few questions around scars. I know we've already covered it a little bit, sort of how long you have to wait, how long scars need to heal before getting a tattoo. And then we've had an extra question in from Jem tonight saying, can you have a decorative tattoo over scars? after surgery. So I think a lot of people wonder whether you can actually tattoo over the scar or whether it needs to go around the scar.
I mean, 9 times out of 10, you can definitely tattoo over that scar as long as it's had its time to fully mature and fully settle. And you go into an artist that has experience in scar tissue and can perform that safely for you. There are a few scars, particularly sort of keloid scars, that it's advisable to maybe not tattoo directly over that. But again, it is a very case by case thing. But your sort of typical surgical incision scars, as long as everything's healed and everything's settled, it's usually absolutely fine to tattoo over it.
So it's another one that's a great question to take to the person that you're seeing for the tattoo.
Definitely, yeah.
And I know one of the other things that we wanted to cover was a little bit around sort of risks that people worry about. And we get lots of questions in around the risk of lymphedema and having lymph nodes removed and whether that means that you can still get a tattoo. We had an advanced question in saying having 1 or 2 lymph nodes removed from each side, does that mean it impacts their ability to get a tattoo? And obviously, yes, we get lots of questions around the risk of lymphedema. It's sort of a major concern for people. Is that a question that you get asked as well?
We do get asked it quite a lot, to be honest. And again, we're not medical professionals, so I can't stress enough that you should always speak to your medical team. Obviously, we can give our opinion from a tattoo perspective, but any kind of medical opinion, it needs to be clarified with your team, kind of thing. I have spoke to several people over about the subject, several medical professionals, including one of our MTA artists, who's actually a nurse as well. Her name's Laura Jane, and she clarified a few things, which was really helpful. So there is always a risk of lymphedema when you get tattooed, because you are putting that stress on the immune system. So that risk is there. Usually with like a tattoo on the chest or like a nipple tattoo, that risk is a lot lower because there are lymph nodes in other surrounding areas that can obviously assist in the healing kind of thing. So the risk can be very minimal, but it is still there. We can't tell you it's not. The only time it's really not advised is if you've had sort of lymph nodes removed and stuff and then you want a tattoo on that limb. So basically, if you sort of to have something on your arm and the lymph nodes have been removed here, there's no lymph nodes around that area then that could sort of take the roll over, if that makes sense.
Yeah.
So that's when it's definitely not advised, is actually on the limb, but sort of on the chest and like nipple area, if you like, the risk is lower.
And again, if people are worried, they can talk to their breast care nurses, to their surgical teams as well. Most hospitals have lymphedema specialists that people can talk to. So yeah, absolutely. If you've got sort of worries and concerns, you can always talk to your treatment teams as well.
Definitely, I can't recommend that enough. But I have tattooed people that do have lymphedema, and we've done nipple tattoos and stuff, and they have been absolutely fine.
Absolutely.
But yeah, always double check.
And I know we wanted to talk a little bit about sort of general aftercare advice and kind of frequently asked questions that you get asked by people coming for these nipple tattoos or decorative tattoos, and also about sort of questions we get asked a lot around, well, how do I know where to find a tattoo artist? We did have a question come in saying, I want a nipple tattoo. I can't find anyone locally to do it. Do they have to be medical tattooists? So I know you've already mentioned sort of having specific training, and you can always ask the artist that you're going to what training they've had. But yeah, if you just wanted to talk a little around these kind of frequently asked questions, is there anything that particularly comes to mind for you?
I think when it comes to finding an artist, it is really important to go to someone who's experienced in scar tissue, even, for your decorative tattoos, like in scar tissue, in mastectomy tattoos in particular as well, because there are these other contributing factors like your reconstruction, whether it's an implant or a DEP or whatever reconstruction you've had, or if you've had no reconstruction at all, there's things that are different to like a normal tattoo, if you like. And then obviously all your treatments and stuff, there's all these factors that all play a part in how that tattoo will heal, how it will sort of behave and react in the skin. And it's super important to go to someone who has that experience. And if they can't kind of tell you about that experience or show you examples, for me, I would find someone who can, because
Yeah.
tattoos are permanent at the end of the day. And you've already been through enough. If you then go and have a tattoo that doesn't turn out very well, or, you know, didn't go the way you were hoping, like, that's devastating, sort of thing. And the same like with nipple tattooing, like, yes, it's very similar to decorative tattooing, and a lot of the equipment and things are all sort of the same or very similar, but the actual form of that tattooing service itself is different. Unfortunately, there are artists out there that think they can kind of give it a crack without having proper training, but you do need that proper training.
Absolutely.
So it is super important. It was one of the reasons I created my charity, to be honest.
Yeah.
So it was one of the reasons I created the Mastectomy Tattooing Alliance. I kind of just wanted to create a bit of a trusted source for people, because you know, where do you begin?
Yeah.
There's so many of us now. So that was the idea behind the MTA, is that we'd have, you know, a sort of collective of artists on our directory who have all kind of been vetted. We know that they're all trained properly, and, you know, everyone's up to date on health and safety, and, you know, all the things that are important. So it just kind of helped in that search, if you like. And then on top of that, we can also help provide funding towards the tattoos for you to help make them more accessible. So I think if you are looking for something and you're not sure, like the Mastectomy Tattooing Alliance Instagram or website is a really good place to start, because everyone on there is trusted by the charity and by me.
And I know some hospital trusts have medical professionals that are trained to do the tattooing, some breast care nurses or surgeons. And I know some trusts have tattoo artists such as yourself, or there's Nip Charity that's sort of aligned with the trusts. So as you say, Mastectomy Tattoo Alliance is a great place to go for information. You can talk to your breast care nurses. There's Nip Charity. So I think there's more and more, it's becoming less taboo to talk about it. There's more places you can go to for advice. And on Breast Cancer Now website, on our tattoo pages, we've actually got a list of resources of trusted places that people can go to for information. And I know you said sort of through the Mastectomy Tattoo Alliance, there's an email contact address, so if people had sort of specific questions about what might be available in their area, they're able to sort of make contact and ask in those kind of specific terms. Is that right?
Yes. So we have a directory on our website. We have a free ebook as well that sort of explains areola tattooing, and some helpful blogs and stuff as well. But like you say, it is becoming like less taboo, and, like, you know, more of a thing now. And there are some really, really good people and some really good organisations around the UK and around the world as well now.
Absolutely. And just so you know, taking the mystery out of it as well, both on our website and your website, you can see photos, which I know a lot of people can't quite picture what an areola tattoo might look like. And it does look, I mean, they're amazing. I know through your website, you can actually see pictures or short videos of what the 3D tattooing looks like. And it's absolutely amazing what can be done. So if anyone's kind of thinking, I just need some inspiration, I'm not sure what things look like, there are ways that you can see photos of things that have been done, both for areolas and for decorative tattoos.
Yeah, like our Instagram pages. So there's my Instagram page, which is just my name, it's just Tanya Buxton, and there's the Mastectomy Tattooing Alliance Instagram page. There's like loads of pictures on there, and we try and show the before and afters as well, so it gives people an idea of, you know, if they had like a similar reconstruction, or they'd be like, oh, you know, that looks a bit like mine, and just to give people an idea of what can be done. But yeah, the websites are full of like really useful information, and yeah, the free ebook as well, which goes through things.
Brilliant. And I know we're coming sort of towards the end of our allotted time, but just sort of a little bit about sort of general aftercare, I know you wanted to mention briefly.
Yeah, so we get asked this quite a lot as well. So aftercare wise, again, everyone has their own little ways of how to look after things. But it's sort of like a typical skin wound aftercare, really. Keep it clean, keep it dry is your basic essentials. A lot of the time your artist will put a protective dressing on the tattoo before you go, just to sort of help accelerate the healing and give it a bit of a protective barrier for a period of time. And then it's just sort of a case of, like I say, keeping it clean and dry, and just hydrated with a mild aftercare cream, which is usually recommended by your artist. It shouldn't really affect your everyday routine in any kind of way, so you can still go about your normal routine. There's a few things that you would have to kind of avoid and be mindful of just in the healing cycle of the tattoo. So obviously you can shower and stuff as normal because you need to keep it clean, but I would avoid having like a long hot soak in the bath, and sort of going swimming or like hot tubs and saunas, anything that's going to kind of encourage that area to stay like wet for a prolonged amount of time.
So very similar to sort of general wound care advice.
It really is, to be honest, because that, you know, you have just sort of grazed the skin almost. It is just a bit of a skin wound, healing aftercare really.
And we did have a question earlier that I realised we were going to answer and we didn't, around whether tattoos hurt.
Oh yes. Oh, that's a big one, isn't it?
Yeah.
Yeah, that's a question I get
Can't
asked all the
miss
time. Yeah. I mean, the answer's kind of yes and no. Like, I always say to people, they're not pain free, but they shouldn't be painful. And if they start becoming unmanageable, then, you know, it's okay. You can just kind of stop for the day, let the tattoo heal, and have it finished another time. In my experience, particularly with sort of mastectomy tattoos and like the nipple tattoos, because obviously everything the area's been through, a lot of the time the nerve endings are sort of damaged, you know, during surgeries and things like that. So the kind of the normal kind of pain receptor to that area is usually reduced quite significantly. A lot of people sort of say to me that they can feel the pressure, but not necessarily the sharpness. And a lot of people do like generally find it really, really manageable. But like I say, if it starts becoming unmanageable, then you can just kind of, you know, just stop, let it heal, and just have it finished another day. It's absolutely fine.
And I think that's really reassuring for people to know that, you know, it doesn't necessarily have to all be done in that session. As you said earlier, it can be over several shorter sessions if people can't tolerate it. So absolutely, you know, everyone's so different, and it's really reassuring for people to know that actually everything can be accommodated.
Yeah, definitely. And that's, you know, that's another thing about meeting your artist. It's you can get a feel for that artist as well. I tend to break my mastectomy tattoos up, like my decorative tattoos, up into smaller sessions, so it is more manageable for people. And I kind of recommend sort of pre-appointment wise as well. You know, just make sure you've had like a good night's sleep before your tattoo. Make sure you've had a good meal, like at least 2 hours before your tattoo as well. It's always nice to maybe take a few snacks with you if you want to. You know, some good old Haribo and anything naughty is usually recommended.
Sounds good.
And maybe just, you know, like a little shirt or a cardigan or a zip-up hoodie, something that can still be open to get to the area, but you can, you know, in case you get cold or you don't want to feel kind of too exposed, you've got something that can kind of cover your shoulders over as well.
Actually, that's really good advice, isn't it? Something that can cover the rest of you so that you're minimally exposed is really helpful tip for people.
Yeah,
particularly
like,
as you say, you don't want to get cold.
Yeah, I mean, a lot of the time, like, we're all private rooms at my studio anyway, so it's nice and cozy, but, you know, some people don't kind of want to be there with no top on whatsoever kind of thing, and it's just that bit of a cozy kind of feeling. But that, you know, other people are perfectly happy to just kind of lay there. It's whatever you're comfortable with, really. But I always advise bringing it because, you know, at least you've got it then if you want it.
And I think that brings us sort of to the final point that I wanted to make sure that we address is this can be a really, really emotional time for people, and as well as all the kind of physical preparation we've talked about, you know, as you say, finding somebody that you're comfortable with, sort of understanding that actually this may bring back memories for you or feel emotional. As you say, happy emotions and sad emotions, because it may well for some people be marking the final phase of the treatment that they've been having. For others, you know, as you say, having to expose the breast might bring back some memories. So it's so important to have somebody that you feel comfortable with and sort of see it as part of that journey. And it sounds like that's something that you're really sort of passionate to make sure people have that kind of positive experience with it.
Yeah, like I love being a part of this bit. Like you get to be part of the nice bit at the end, and
Yeah, it can be
you
so
know
empowering.
it really is. And just I say it time and time again, but when that person looks at themselves in the mirror for the first time after their tattoo, you can't beat it. It never gets old. Like I love it, and it's just so nice. You see people, they just they stand differently, and you
Yeah,
can just see how they feel so much like better in themselves again. And like I've had people that have then messaged and been like, "Oh, I finally took my kids swimming because I
oh,
never
that's
wanted to
fantastic.
before because I was conscious," and all these things that we might take for granted. You're giving people a piece of their life back. But as much as it is very empowering and uplifting, and it's beautiful, it can be very emotional for people, and it can be a bit triggering. It can bring
Yeah,
things back. And particularly my studio, Paradise Tattoo Studio, we are there for the sort of emotional support for you as well, because it is a real important part of the journey. So it can be a mixture of emotions, kind of
yeah,
thing. Yeah,
absolutely.
but it's
And
amazing.
yeah, if anyone is listening thinking, yes, sort of I've been through this journey and I'm feeling emotional, obviously there's always the breast cancer now helpline as well. So, if people are going through this and actually feeling they just need somebody to talk to as they go through it, you can always call the nurses or call your breast care nurses as well. So there's lots of avenues to get that support if you need it. And that's been absolutely amazing, Tanya. And I know we've run a little over time, so thank you for staying with us. I think we've gone
That's all
through
right.
so many questions that people want to know around tattooing. And just say, if anyone wants any more information, you've got the tattoo pages on the Breast Cancer Now website where we link out to lots of resources. Top of the page is Tanya's Mastectomy Tattoo Alliance webpage, which is fantastic. On that webpage, you can find a directory of artists and some photo galleries, as well as being able to contact Tanya with any questions. You can also send any questions or any thoughts or worries or concerns you've had from today's session, as I say, through the helpline, which is open again from 9. Just to give you the number again for that, it's 0808 800 6000, or you can use our Ask Our Nurse service to email us a question or submit through Instagram as a private message. So lots of places people can go if they've got questions. And just to say, Tadia, thank you so much for all your input tonight. It's been really, really fascinating. I'm sure everyone watching has taken loads away from today. Have you got any final thoughts that you'd like to leave everybody with?
I'm really thankful that I can be a part of these journeys for people, and I'm really happy that the MTA can help people as well. And like I think really just sort of recovering what you've said, if anyone needs any kind of advice or is looking for resources, the Mastectomy Tattooing Alliance website, it's just mastectomytattooingalliance.org. Like you say, it's on the Breast Cancer Now website. It's full of useful information, and really helpful blogs, and our free ebook on the areola tattooing as well. But you can also email us if you have specific questions, and we can answer those for you as well.
Amazing. Thank you so much, Tanya. And thank you, everybody that's watched tonight. Really appreciate it. And as I say, if you have any questions, do get in contact. But other than that, enjoy the rest of your evening and thank you for joining us.